The following program is sponsored by Southwest Pain Group and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.
Hello and welcome to Ask the Doctor. I'm your host, Mike Berger, here to answer your questions on pain management and alternative pain management. Today is Dr. Robert Bulger from the Southwest Pain Group. Southwest's mission is to care for patients who suffer from chronic and acute pain. The Southwest Pain Group is actively involved in the care of patients who suffer with pain issues. Just call the number that you see on the screen. It's 1-888-572-4411, or go to the website www.southwestpaingroup.com. We're going to start today's show off with a look at a common complaint, or what I think has become a more common complaint, fibromyalgia.
Yes.
So I guess people have found out more about it, including the medical community?
Yes, and it's a very interesting and yet very challenging diagnosis. First of all, it's controversial. There are actually physicians today that still think fibromyalgia does not exist, but is simply an element or an overlay of depression. But in fact, over 12 million people have the diagnosis. It's about a 10-to-1 ratio of women to men. And it's a frustrating condition because there is actually no specific one treatment for it.
Are there certain things you look for, Dr. Bulger, when you're trying to diagnose this disease?
Well, yes, because first of all, the symptom complex is rather diffuse. It's achy joints, kind of chronic fatigue, pain all over, depression, insomnia, difficulty concentrating, literally irritable bowel. I mean, there's such a symptom complex that it often masquerades. And so you have to go through a process to figure out, make sure it's not something important.
So it's not something that you can take a quick test.
But
well, I understand, but it's not something you can take a quick test for and, oh, that's what it is, fibromyalgia.
No, in fact, it's a very frustrating condition, and that's one of the reasons it's now more in the news. People are finally accepting the fact, okay, people have this, what are we going to do? Mm-hmm. You look for things like thyroid, you make sure it's not a heart condition, vitamin deficiency, lupus, rheumatoid diseases, you go through a whole list. Lyme disease, for example, mm-hmm. could create the same symptom complex, mononucleosis. So once you go through all those things and make sure they haven't got that, then you finally arrive at it's probably fibromyalgia.
Are there specific treatments or a battery of treatments you can use to help people with that?
There actually is no one treatment because there's not a cure for it. So what you do is you focus on the symptoms. And usually the main symptoms are depression, insomnia, and a lot of pain.
Okay. Now on the phone lines, and we want to remind our viewers, if you have any questions about fibromyalgia, or for that matter, any other painful medical condition, you can call the number on the screen. It's 1-888-572-4411, or go to the southwestpaingroup.com. Now we have our first phone call from Martha in Grand Prairie. Martha, go ahead with your question.
I'd like to know if you could do anything about the pain of fibromyalgia from the joints and pain sites. Thank you so much. Have a good day.
Well, yes, actually, there are things you can do. And again, we just spoke about it. Everything from conservative to aggressive. A lot of times, you have to figure out where the pain is. Many times, the pain is in particular areas called tender points. And fibromyalgia patients have more of these. Everyone's heard of like a trigger point or a little muscular sore spot. But fibro patients, and we call them fibro is kind of the slang in the medical lingo, they have more of them in more places. So we'd focus on that with her. She may also have joint pain, and I might consult a rheumatologist and have a rheumatologist help me with that. So drugs that treat arthritis, medications to treat muscle pain, and actually there are a lot of homeopathic and natural therapies, including hormone therapies, that seem to help.
So it's not necessarily just a joint pain or a muscle pain. It can be a combination of both.
Well, interestingly, with fibro, the presentation is variable. So, for example, maybe you have a lot of chronic abdominal pain and occasional aches and pains, and your wife says, stop complaining, go work in the yard, you know, like this morning. But the reality is you might have that, although it's more common in women. But the confusing and challenging things because the symptom complexes are so variable.
Interesting disease, and I'm sure that people are doing a lot of research on it, trying to narrow this down and even make a better diagnosis for it in the future.
Well, we're kind of accepting it. And remember, I told you it's a controversial diagnosis. Some physicians didn't accept it for a while, and now they are, so I think we're seeing more about it.
Very good. When we come back, we're going to take more of your phone calls, and we'll look into the use of ultrasound in pain management therapy. Stay with us.